Good afternoon, and welcome to our 7th session in our first virtual Successful Aging Expo. Today's session is entitled Dementia and Safety Issues. My name is Al Manzi. I'm the President and CEO for Prairie Mountain Media and publisher for the Times Call. Before we start, at the bottom of your screen, whatever device you're using, you'll see a Q&A button or a chat button. And you can use those to actually enter your questions as we move along through the presentation. After the presentation today, I will take specific questions from the ones you've entered during the presentation, and I'll add some at the end as well. Today, our presenter is Dr. Haleh Nekoorad-Long. She's a board-certified geriatric psychiatrist for AltaVita Senior Resources. So please join me in welcoming Dr. Long.
Thank you. Hello. Hi, so as Al was saying, I'm a geriatric psychiatrist and have been practicing for almost 24 years. This is a very important topic that I think we don't talk about too much because everybody is fearful of what would the patient think or say. But it's a very important issue to bring up, and I'm glad that this is being hosted by you guys. And I'm going to go ahead and get started. So first off, I always like to talk about what it means to have dementia, because people usually say, you know, that so my mom doesn't have dementia, they have Alzheimer's, correct? But the problem is that Alzheimer's is actually a type of dementia. And it would be if you say, I have cancer, and then people say, what type of cancer? It's kind of in the same category. So impairment in short-term, long-term memory, impairment in abstract reasoning, abstract thinking, impairment in judgment, which causes the safety issues, which we'll talk about in a minute. And people also can have personality changes. They can forget how to do things, which also puts them at a safety issue. And they also have difficulty with their speech, which causes agitation. And there are different types of dementia, and like I said, dementia itself is a series of symptoms, and then the reason that everybody thinks of Alzheimer's is because this is the first type is the Alzheimer's dementia, 50 to 65%. Then there's another one called vascular type dementia, which is 10 to 15%. Lewy body dementia, which is another 10 to 15%. Frontotemporal lobe dementia, 5 to 8%. And then if people with Parkinson's live long enough, they will develop dementia by 40% of them will develop dementia if they live up to 10 years after their diagnosis. And some of the facts and figures, I took this right out of Alzheimer's Association website. 1 in 8 Americans have Alzheimer's, and 1 in 3 older adults die from dementia-related illnesses. So dementia itself, people always ask too, you know, dementia itself doesn't kill you, but it kills you to what it does to your body. Because as your brain shrinks, you start having problems with swallowing, so it puts you at high risk of aspiration pneumonia. It causes you to fall, so it puts you at higher risk for falling. So 1 in 3 older adults die of some sort of dementia-related illness, which is huge. And Alzheimer's, it's the 6th leading cause of death in the US. it's getting up there with prostate, breast cancer, COPD, all these kind of different causes of death in the US. And over 16 million Americans provide unpaid care for someone with Alzheimer's. And dementia costs our nation $305 billion in year 2020. By 2050, because we're going to have more and more dementia patients, that number is going to jump to $1.1 trillion. So some of the important issues, the reason that we're talking about this is safety is number one, but personal hygiene, behavior concerns, nutrition, which also puts you in danger, time and energy put in as a caregiver, financial concerns, then caregiver issues on their own, like if they're having their own health issues. And then, we'll talk about in-home options versus moving to a community, which is a very personal decision. And I just put this up again because I think it's really important to understand that dementia and Alzheimer's are kind of the same thing. Alzheimer's is just a type of dementia. And this one I actually show to the families or the caregivers, even at the memory care when I do the educational stuff. Because as you can see, hopefully we all have a good brain, which is to the left of your screen. It's red, the metabolism is healthy. And as you start getting more and more demented, the second one is mild dementia, the third one is severe dementia, and the last one is actually a 5-year-old brain. And I'm not saying you become a kid, but you do start developing some problems with decision making, putting you at safety risk, because you wouldn't leave a 5-year-old on their own at home. So that's why you have to think about the safety issues. And wandering off from your home or the facility, getting lost, insisting on driving while you know that they're unsafe or they're getting lost, managing their own medications, accidents on the stove, microwave, refusing to use safety equipments like walker, wheelchair, grab bars, falls, smoking accidents. And I'm actually going to add one more to this. I came across this morning, was guns, because I have a patient that I just admitted, and he was paranoid, he's demented, and he has a gun, which is not a good idea with somebody who's demented and paranoid. And he was trying to protect himself because he thought people were breaking into his house, and he was aiming it at his neighbor, which was not good either. So gun safety should be on this list too. I'm going to add it for my next talk. Wandering behaviors is huge because even if you're in a nursing home and the ones that are not secured, up to 30% of patients walk away from their nursing home. 6 in 10 patients with dementia who reside in the community, so in their own home, end up wandering off. Most of these people, 94% of them, are found within a 1.5 mile radius of where they disappeared. But if they're not found within 24 hours, 46% of them can die of hypothermia or dehydration. So depending on if it's winter or summer, up to 50% of if they're not found within 24 hours are going to die. No one can predict when wandering will occur. And this one I just put in, it's a really sad story of this couple that they were both a little demented, but not all the way. And family didn't want to tell them not to drive, but they started driving. The daughter noticed that they'd forgotten their cell phone. So what ended up happening was they left on a Saturday morning and they were found on Tuesday evening in Macon, Missouri, which was a 9.5 drive from Sterling. And it was 4 hours south of where they intended to go when they started. And they were found, but I can give you a lot of stories that people were not found. A couple of them in Boulder County that it made it to the news. Unfortunately, they were not found alive. So this is a huge one with kind of them wandering off or getting lost and being found. So Alzheimer's Association has actually this nice program called Safe Return Bracelet, which is for people that still live at home, but you can also get it like if somebody's at a regular assisted living or independent living and you worry about them wandering off. You can join online. It's medicalerts.org/ALZ. The nice thing about this one is that they get a bracelet and they can't open it unless you use 2 fingernails. So you can't open it on your own. So it always be on them. And another nice thing is that there's no personal information except your first name and ID number and 800 number. And as soon as the patient is lost or they, you know, that you feel like, oh my gosh, they walked away, you call the 800 number and they fax the patient's picture and information to all the surrounding police stations, and a search becomes like, you know how they do the silver alert. A search becomes active and hopefully, you know, they can get found. And another part is too, I had one patient that actually had one of these bracelets and he wandered off. Their wife didn't know. Thank God, it was actually a postman who noticed that this guy looks confused, should not be out here, and looks at the bracelet, calls the 800 number. Alzheimer's Association calls the wife and goes picks him up, just a couple of blocks down their street. So this is a really great program. And then there's another one called Comfort Zone GPS, which is it's a location-based mapping service. It costs a little more than the bracelets, and it can be worn like in a bracelet, or they can have it on their shoes, or you can mount the GPS on someone's car. There are multiple devices online. I was checking a couple of days ago, and there were some good reviews, bad reviews, so it all depends. And Alzheimer's Association doesn't really have a recommendation of which company to use. This one is Colorado Life Track, and it's through Boulder County Sheriff Department. It's a $250 donation to get a wristband. If you can't afford it, you can get it for free. And then after that is $10 per month subscription fee. This is a number for the Boulder County Sheriff Department. And it is a radio wave kind of location provider. And the nice thing about this one is that the Sheriff Department kind of starts looking for you if your loved one is lost. Driving safety is huge, huge, huge. I always unfortunately, my own dad, I had told my mom, like, he shouldn't drive. And of course, what does my mom do? Lets him drive because she was like, well, he gets really upset when I don't. But that's one of the problems, is that we are always worried about how the person is going to react. And, you know, unfortunately, there were an accident. He didn't kill anyone, but he could have. But this is a huge one, you know, when you notice that I always say, if you don't feel comfortable putting your kid in somebody's car, they should not drive, which that was my case. I was like, no way, you're not gonna pick up my kids and you should not drive. So one of the keys is that they're experiencing multiple traffic crashes, and it may not be like anything huge, but, you know, putting dents and dings in the car, running into posts. And the problem with dementia and driving is that people stop using they lose their perception. So their depth perception is not there, and that's why they get into a lot of accidents. They miss stop signs. So that's a huge one. I know it's a difficult conversation to have because, again, people are fearful of being disrespectful to their parents or their loved ones, their spouse, and then it becomes a burden on others for riding. But we have a lot of good stuff in Boulder County. That VI is a huge one that you can schedule rides with them. It's very cheap and it's available. And unfortunately, as humans, we always wait for a crisis or a crash to occur before we do anything, which was the case in my own family. AARP has a great free online seminar called We Need to Talk, and it talks about how to talk to your loved one and how to assess your loved one's skills. If you don't want to do it on your own, there are services called driving evaluation services. Is through CNS, which is a Center for NeuroRehab Services. They have 2 offices in Fort Collins and Littleton. Unfortunately, there's nothing in Boulder County available. This is out-of-pocket pay. Insurance doesn't pay for it. But it would be a nice one if you kind of feel like, I don't want to tell them to stop. So these people will tell them to stop driving if they don't pass the test. This is the next biggie, which is financial abuse of the elderly is common, sometimes with their own family. If you do suspect anything in Boulder County or in Colorado, actually, everybody's responsible to report financial exploitation or physical abuse or any sexual abuse exploitation to the Adult Protective Services. And sometimes, it can be little by little per month, or the relative is living with the dementia patients for free and they're not contributing to the household, or it can be large sum of money that they take out of their account. Medication management safety is huge. On average, ages 65 to 69, they take nearly 14 prescriptions per year. Age 80 to 84, 18 prescriptions per year. And you tell me that you're not going to make any mistakes with this many prescriptions. I only take one medicine and I'm always like, oh, did I take it today? Did I not take it today? So just add 14 to that list, and it's pretty tough. Seniors represent about 13% of our population, but they consume 40% of prescription drugs and 35% of over-the-counter drugs. And this is important because you want to coordinate your care with all your healthcare professionals, because people go to specialists. They have their primary care doctor, but they also have, on average, they can have up to 3 specialists at the same time. Everybody gives them different medications. A lot of these medications have drug-drug interactions. People think that if they're taking over-the-counter like herbal or vitamin supplements, it's okay, but a lot of times those medications can also have drug-drug interactions. So each time they go to an appointment with their doctor, they need to take their list of current medications and dosages and question, do I still need this? Because a lot of times it can be for only a few months or a few weeks and can be stopped. Following directions is important, because with dementia, you know that sometimes people are, that they're having problems with their memory. They have trouble following directions. So maybe that's why they keep going to the ER. We call them like frequent flyers in the ER, because you know, they keep coming back with congestive heart failure, and nobody stops to say, whoa, is this person still taking their Lasix? Or they come in and you say, oh, you have congestive heart failure, you need to take Lasix, and they go home and they forget and they never take it, so they end up back in the hospital. Or it can be cost or side effect. The new news about metformin causing cancer, or metformin is a diabetic medication that is in the news now, that it has a carcinogenic component in the medication. So now people are going to stop taking their diabetic medication, and then we're going to wonder, oh my gosh, why is your sugar 300? So please, you need to consult with your physicians before you stop any medications or change the dosages. Giving some medication to someone in early dementia, this also is hard, but using pill box organizers is nice. But you need to make sure that they actually, their memory is intact enough to remember that it is Monday, and it is Monday morning, not Tuesday evening, so they take the right time and the right dose. Because even though it is inexpensive, because it's only like a plastic one, they're usually anywhere from $4 to $10. But it still needs to be filled, and they still need to know what time it is, what day it is for it to take it. And then reordering can be a challenge, because nowadays, you know, a lot of the pharmacy programs, they want you to get a 90-day supply, which is fine. But if you wait until the last few days that you run out, it's going to take you 10 to 14 days to get medications in the mail. Electronic pill dispenser is nice, especially for the ones that we know they're not going to be able to just manage those plastic cheap ones. This one, it still needs to be set up by someone, and it automatically starts with an alarm, and a drawer opens up, so it dispenses it automatically. Well, one of the disadvantages is that if you have problems with arthritis in your hand and you can't grab pills, or if you're hard of hearing or you're blind, it makes it challenging. And then, of course, in the later stages of dementia, it becomes even more challenging, because even if they remember, or if you even give it to them, you have to be very specific about steps. Put it in your mouth. This is for your blood pressure. Drink some water. And even then, people may start spitting out their medications, and then you have to start crushing it, especially if they have swallowing problems. You may need to look at oral suspension or getting the medications crushed. And to make sure that you put in the medications in a locked drawer or a cabinet to avoid accidental overdose. Again, I always use my dad because he's done all these. We used to set up his medications in the plastic kind, and my mom would divvy it up to him. But one day he got up in the middle of the night and he thought, oh, I didn't take my medicine. It was Monday night. She had already given him Monday night medication. He went to the kitchen. He took Tuesday night, and he had a fall because he got hypotension from taking 2 blood pressure medications rather than just one. So that's a real thing. And if you think that's going to happen, you need to either lock it in a drawer or keep it away from them. Keeping local poison control center or emergency room number is good. And of course, calling 911 is always an option. Behaviors with dementia, this one is pretty self-explanatory. It's agitation, combativeness, suspicion of spouse or caregivers, which is the most common type of delusion. People usually think like their spouse is being unfaithful to them when they don't see them, or if they're ever gone out of their sight, they start thinking that this person is cheating on me. Refusing care is huge. Harming themselves or others because of any of these agitation combativeness. And then, of course, all of these symptoms are worse in the evening, which we call sundowning. And any of these behaviors can make it unsafe to live on your own, and families can have caregivers that will come into the home, but if they're agitated, they're combative, that's not a good fit either. And I just put this one in because I think it's important to keep your composure, that you don't, when somebody's agitated and have dementia, you don't lose your cool, because that just makes everything worse. So the recommendation would be to approach them from the front, not from their back, because you're going to startle them and they may hit you. You're going to identify yourself and explain what you're doing. Making good eye contact is huge. Speaking slow and calmly, because you don't want to be loud, because that's just going to put them over the edge and cause more anger. And don't assume that the person is hearing impaired. I've done that. I've been guilty of that before, that, you know, they're not responding and I talk louder and louder. And I had one cute gentleman who told me that I'm just ignoring you, I'm not deaf, which I love that, because you know, I was talking louder and louder and making him more angry. And they use short, simple words, yes or no questions, no open-ended questions. Ask one question at a time, allow them to kind of come up with a response, and then if necessary, repeat your question. And people with dementia might only understand a part of your question, because remember at the beginning I said aphasia is a part. Aphasia is people not understanding speech. So you can have comprehensive aphasia or expressive aphasia. Expressive aphasia is when you are talking gibberish, so you don't make sense to you, and you think you're saying it the right way, and then you get upset because other people don't understand you. But also another part is comprehensive aphasia, which is you don't understand what's coming in, you're not processing it. So when the person with dementia is kind of looking at you puzzled, or they don't understand and they're just getting more and more upset, try some nonverbal cueing. So you can, you know, let's say you want to tell them that, okay, we're just going to go for a walk. I'm not going to talk to you anymore, or I'm not upsetting you. You don't have to take a shower. Just kind of use hand motions, you know, stop or no or yes with your head, instead of trying to kind of explain yourself. And again, don't be loud with them, because that's just going to make everything worse. And another thing is avoid correcting them, avoid reality check, especially when they're agitated. So if somebody says, you know, I just want to go home, I just want to go home, you don't say, hey, you're already home. Guess what? You're already home. This is your home. You don't say that. You just kind of say, okay, all right, let's think about it. So you want to go home? Okay, can we have dinner before we go home? Or can we have some tea before we go home? Instead of saying that you're already home. Or if they are saying that they want to take care of their cat and they don't have a cat, you don't say, oh, you don't have a cat, your cat is dead. You say, oh my gosh, so we got to look for the cat. Okay, let's do that. So please, whatever you do, don't confront them, don't reality check with them at that moment, because you're just going to make them upset, and in turn make them agitated and yourself upset. Food and nutrition is huge, because, you know, one of the problems is that a lot of dementia patients, their frontal lobe is messed up. So they either don't feel hungry, or they're always hungry. They're always feeling hungry. And And the problem with the food and nutrition on your own, if you're living at home, is that one of the problems is that you have to remember to eat. You have to remember that you're hungry. And then you got to start looking for what's appropriate to eat. And maybe it involves warming up the food, which can be scary because the microwave, and people have left spoons or forks in the microwave and it's blown up. So nutrition and food becomes a huge one if your loved one lives by themselves. Weight loss, dehydration, vitamin deficiency, and then illnesses from eating bad food because they kept the food in the fridge too long, and they got food poisoning, which they got diarrhea, and then they got dehydrated. And especially at the beginning of dementia, people are very self-conscious because they know that they're not doing well, but they're trying really hard to keep it together, hiding it. So I had a lady who got dehydrated because she had diarrhea, but she didn't want to tell her daughter because she didn't want her daughter to be mad and say, you're just going to have to move into assisted living. So by the time we found out, she was delirious because she was so dehydrated from her diarrhea. And as I mentioned at the beginning, swallowing problems happens from what the dementia does to the brain. So as your brain shrinks, it affects the part of the brain that has to do with your epiglottis, and it causes the muscles not to move so smoothly. So people start having swallowing problems, which puts them at higher risk of aspiration pneumonia, which can cause illness. Personal hygiene is huge issue with safety, because if they're urine and or bowel incontinent and they're resisting bathing, especially in female population, because of the way our plumbing is, if you're not taking care of your hygiene really well, you put yourself at a really high risk of urinary tract infection. So if they're urine and bowel incontinent, it becomes very important and imperative to get them changed more often, bathe them more often. But guess what? A lot of dementia patients, they don't like to be changed. They don't like to be bathed because they still feel that they want to be independent. And then at that beginning slide, part of the memory or part of the dementia symptom is called apraxia. Apraxia is when you start forgetting how to do things. And that can be something simple like brushing your hair or brushing your teeth becomes a challenge. And sometimes they're unwilling, sometimes they're unable to do personal hygiene for themselves. And the care needs are becoming too difficult or too demanding for the caregiver. And that's kind of what happened to my parents, because my dad would just not shower, started to become incontinent. It was very difficult for my mom to change him. And time and energy spent by the caregiver to ensure safety. I mean, this is kind of what we've been talking about the whole time, which is they need help with most of their activities, the dementia patient, including eating, bathing, dressing, hygiene, medication. Housekeeping still there. Fatigue in caregivers huge. Missing work, especially if the caregivers are still working, if they're children of, or if they're younger couple and the spouse is still working, it becomes very difficult to juggle both. And with my generation, we're kind of like the sandwich generation of we need to take care of our kids, but also our parents are becoming, they're starting to need help. So we're kind of the sandwich generation in the middle. Caregiver burnout is huge, huge, huge. You know, they usually are just lucky to make it through another day. They start ignoring their own medical issues. I had a couple that the wife was devout wife and took care of the husband who had dementia and it was getting worse and worse. And she kept putting off her own medical needs, including her cardiac needs. And finally, she had chest pain and a heart attack at home with her husband there. She's calling 911. They come and they're like, oh, what do we do with him? So basically, they took him to the ER too until a family member was able to come and pick him up from the ER. And again, as humans, we just wait for a disaster to happen before we do anything instead of planning ahead. And then lots of privacy. If you're bringing somebody in home from a care agency, like my mom hated this because she just said, you know, I don't know what to say or what to do with them. They're just like sitting there. And so she was very uncomfortable with having somebody in the house. And if you have like a big family and some families are involved, some families are not involved, that also becomes a huge deal because people feel like, you know, I'm doing all I can, you guys need to contribute, and some families don't want to be involved. The caregiver becomes overwhelmed and exhausted, and these are the signs of stress in caregivers, which is interesting because if you look at it, you would think this is the patient. You know, they have anger, anxiety, they're irritable, they're in denial, they lack concentration, they suffer from depression and anxiety, they're sleepless because the dementia person usually has disrupted sleep pattern. So therefore they become exhausted, they get socially withdrawn, especially nowadays with COVID. You're already not going anywhere, and even if your loved one used to go to like a daycare program, they can't do that anymore. So you become more and more socially withdrawn. And 50% of caregivers meet criteria for major depression. In-home care with the help for caregiver using services such as meal delivery, housekeeping, companionship, daycare programs, which is unfortunately on hold because of COVID at the moment. But that was awesome. You know, when my dad used to go to daycare program, and that would give my mom about a 5 to 6 hour period to herself. But when COVID hit, he just couldn't do that anymore. And then you can do overnight respite care, like for a week, 7 to 10 days at a time at memory care centers. Most of them have it. Getting help from family and friends can be a challenge. Like I said, people feel resentment that, you know, I've done this all these months and now it's your turn, and the other person is like, I can't do it because I have work or whatever reasons. So it becomes a really sour point in families. And when is the right time to move? This is a very difficult question, and it's a very emotional process. It's a very personal, individualized decision because there's no right answer and there's no right time for anyone, or there's no right time for everyone at the same time. Each family is different, each person is different, each family need is different, family beliefs, family culture. But I usually say that you need to do like a family meeting intervention of getting the family members, friends, neighbors, whoever that you think knows this person the best to get involved. And if appropriate, get the person with dementia involved. If you feel like that's going to make him feel very anxious and very agitated, I wouldn't suggest to involve that person at the beginning stages when you're looking, because that's just going to create more anxiety and agitation for them. And I always say, sometimes you have to make that decision for both of them, or for both of you. Like, I know it was very controversial for my family when I decided to put my dad in memory care because he, I mean, he didn't obviously know himself anymore, but my mom didn't want it, and I just didn't want to see my mom continuously getting worse and worse herself. So I am the POA, so I made that decision to do that for them. And I know my mom kind of resents that decision, but I think at some level she was happy that I was the one making the decision for them. But that's why we pick POAs. You know, my husband is my POA, and he knows exactly what my wishes are. And, you know, I hope that he makes the right decision when that time comes. So in summary, I would say, you know, plan ahead to prevent disasters. Like I said, as human beings, we always wait for a crisis to make hard decisions, but please don't. And put in the safety measures of having a medical power attorney, a durable power attorney, a living will, and will before that person becomes to the point that they don't recognize or they don't know what day it is, because those are the things that the attorneys will ask, you know, do you know what day it is? Do you know your family members? Do you know what this means? So, because if you don't have all these paperwork in order, and when your person is demented at a later stage, it becomes a huge legal mess, and you would have to do a guardianship instead of a medical power attorney or durable power attorney, which is a lot more expensive, it's a lot more involved, and it becomes very messy. And then safety measures, like I said, financial, driving, medication, nutrition, wandering, unsafe behaviors, and I'm going to add guns to this one because of the person I saw this morning. I just didn't think about that one earlier. And always know that it's all right to ask for help. I know, again, from my personal experience, my mom is a very proud woman, and we are Middle Eastern, and she just felt like, you know, that she was it. She had to do it, and she didn't mind doing it, but she was killing herself doing it. So it's all right to ask for help, for emotional, physical support help. And I put the ALZ.org because there's so much good information on that website. And I'm going to try and see if I can do this. Can you guys see this? Okay. So I got this from the Alzheimer's Association website. And as you can see, it has some really good tips for how to make your house Alzheimer's safe, basically. And most of it is common sense, but a lot of it is like little things that you don't think about, like, you know, locking up your laundry detergent, your bleach. I can tell you that my dad had done something terrible with the bleach, but nothing terrible happened. But after that, we made sure that we locked up everything that was harmful, almost like child-proofing your house. And then this one, it says, you know, removing firearms, which is the guns that I was telling you about. Kitchen is huge. Again, microwave can be a danger because people forget and they leave their forks or spoon in the microwave, blow it up. One way of doing safety would be to removing the knobs from the stove. Sometimes if it is electrical, you can just unplug the stove. Disconnecting the garbage disposal, because yes, that has happened, that people put in their hands in the garbage disposal to take something out. Another horrible experience that I've had with a family was this stove safety. I had said it so many times that, you know, she's not safe. She should not be using the stove by herself. So the husband went to get some Danish for the morning, and the wife was trying to make coffee, but they had the percolator that's on the stove, and they had fire stove, and she caught on fire. Her nightgown caught on fire. And when the husband showed up, she was on fire in the kitchen. It was horrible. But I'm telling you all these horrible stories to please, I know everybody thinks none of this is going to happen to them, but it can happen to anyone. Laundry room, we talked about just a little about locking the washing machine or locking the detergent and bleach. Bathroom, setting the hot water to 120 or below to prevent scalding. Bedroom, don't have electric blankets, heater, heating pads to prevent burns. And have a seating area near the bed. So when they're getting dressed, they can sit on the bench rather than on the high bed. The garage and basement, limited access to large equipments, lawnmowers. That was another thing. I have had an unfortunate event of this one gentleman who was riding a lawnmower and ran into a tree, had a head injury, and actually died from that injury in ICU. So, okay, 11:45. I know I promised Al that we'll leave some time for question and answers. So, right on time, Al.
Perfect, Dr. Long. Your information is just drop dead right on, and it's so helpful. We do have some questions. The first one that came in was from a woman who said, "My husband is dealing with some dementia, and she's noticed that Mondays are extremely difficult for him in terms of his memory. Do you have any idea what would cause this?" She says usually the next day he gets better.
Well, it could be several things. One is if on the weekend you're out of your routine, because dementia patients do really well with routine. So if, let's say, on Saturday and Sunday, you're not doing the same thing, you're meeting with the family or you're having coffee in a different coffee house, it can be jarring for them. So with dementia patients and frontal lobe, routine is very important. So whatever you do on Monday through Friday, try and do it on Saturday and Sunday and see if there's a difference.
Thank you. Next question is COVID and dementia. Should we talk about it or not? He doesn't seem to be aware of what restrictions affect him, like visitors or shopping. It's a good question. How do you deal with that?
Yes. So I always say if it's agitating to them, don't bring it up. And also, if he doesn't remember and he doesn't recognize, he doesn't have the insight that he needs to have restrictions, there's no point of keep bringing it up because it's just going to make him upset and make you upset. So try your best to have restrictions without keep reminding him, remember, there's a virus. Remember, you don't need to do this. Just kind of guide them through it like you would, like if you had a toddler, you know, you don't keep telling them, no, you can't have candy. You just take the candy away instead of just leaving it in front of them and telling them that you can't have it.
So we have somebody who's asking for some advice, some practical advice on how to get a person to take a shower. She does have a caregiver, but she's just refusing to take a shower. Do you have any advice on what she can say or they can say to get through that problem?
Yeah, that's a huge one. It's a really hard one. But sometimes, a lot of times actually, you don't argue with them that you need a shower and you don't build up to it. You take towels, clean clothes, and you just go to their room and you say, come on, and just show them the towel. Don't say you're going to take a shower. You just say, come on, let's do this. Come on, let's do this. And then if they ask you, I just took a shower, you said, well, we'll just take another one. And sometimes they actually ask, well, do I stink? Is that why you want me to do it? And you can be honest and say, yes, you do smell, and I don't want you to get a urine infection. And your doctor said that you're going to get skin breakdown down there if you don't do it, and you're going to get a yeast infection. So don't argue with them that you did not take a shower. You just say, oh, you did take a shower? Great, let's go take another one. And like I said, because sometimes they're aphasic, so they may not understand what you're trying to say. And sometimes they do better with caregivers. So it is good to send a caregiver in with a towel and clean clothes and just tell the caregiver that, just bring him on, just say, come on, let's go do this. But it is very hard. And sometimes with, like I said, routine works better. So you can have like a schedule on the refrigerator and say, you're going to take showers on Wednesday mornings. And just write big letters, shower Wednesday morning. And then when Wednesday morning comes, do the clothes, show them the towel and stuff.
And how, what practical advice would you give to a loved one or a friend that sees someone with the beginnings of dementia? How do you start the conversation with them?
So usually the best way is to ask them first, to say, do you think you're getting a little more confused, or are you having trouble keeping up with the information? And believe it or not, they're a lot more aware than we think, but they're keeping it together because they know what's going to come next. So asking them with that concern, that you have a concern that, you know, I've noticed that you're having some problems, and do you mind if we go to your PCP and talk about it? And there's also some really good questionnaires on the ALZ.org, the Alzheimer's Association website, that you can print off and read together with your loved one. And you know, you can say, you know, there's more stuff we can do if we diagnose early. And I'm not saying you have it. I just want you to get an assessment and see. Because I'm not a doctor. We need to kind of find out if you have it or not. And I'm just worried about you. And guess what? They're probably going to say, no, there's nothing wrong with me. And you can say, well, let's just go talk to Dr. So-and-so and see what they think.
Thank you. What advice would you give to somebody that's looking for a good memory care facility? What are the things that you would look for in a good memory care facility?
So couple of things. One is go and visit. And I know with COVID nowadays it's hard, but put your foot in the door, at least in their front door, just to kind of get a sense of what it looks like, what it feels like. And smaller communities that are not part of a huge corporation are usually run a little better. There's less red tape. But really, word of mouth is the best thing. And the feel you get when you walk into the building, the energy, the helpfulness of the person up front that as you walk in. And you know, a lot of them these days, they want you to have appointments because of COVID. So make an appointment and say, no, I want to come in, and it's okay. I'm just going to visit your front desk. You know, I don't have to come in, because a lot of them now have virtual visits. So they can show them to you on the computer. But if it was me, I would walk into the facility and just get a look and the smell. And I'm not kidding, but just kind of get a sense of what it feels like, what it smells like.
Thank you. And, we've talked a lot about dementia, but what can healthy people do to slow down or reduce the potential for dementia, even if they have a heredity issue in their family?
Yeah. So just because you have a genetic component to it, it puts you at higher risk for dementia, but it doesn't mean you're going to get dementia. But yes, you are at higher risk. Even if you're not genetically predisposed, the best things that have shown to be helpful with slowing down the progress of memory loss or prevention of memory loss is physical activity. And it's 20 minutes. It's not like you don't have to work out for an hour every day. It's 20 minutes of aerobic exercise to the point that you're not able to talk. You're breathing so heavily that you're not able to talk. 20 minutes 3 to 4 times a week has been shown the best prevention for heart disease and brain disease. And another thing to remember is whatever is good for your heart is good for your brain, because usually when you do brain scan with dementia patients, they've had like little, what we call mini strokes, or we call them ischemic changes, but they're like little mini strokes that you don't know you're having them. And that can be from high cholesterol, hypertension, diabetes. So basically keeping yourself healthy, keeping your blood pressure under control, cholesterol under control, diabetes under control, and exercising, aerobic exercise. And if you're worried that, your memory is getting worse and you kind of see yourself going that route, actually another thing they said was the best thing is either learning a new language or learning a music instrument, which has to do with crossing the brain from right to left. And then diet, Mediterranean diet, which is high in antioxidants and good fatty acid foods. So those are the things like nuts, avocados, low carb, low fat protein, and lots of vegetables. Yeah.
Thank you. I like that. If it's good for your heart, it's good for your brain. That's
Yes.
a good way to remember it.
Yeah.
And you're in the field, and maybe this could be our last question. You can talk a little bit about what's happening with dementia. Are they making any progress medically, or from a research perspective? And what do you think the next 10 years might look like?
Right. Yeah. Unfortunately, our brain is such a complex organ, right? So it's been very difficult. So when my daughter was born is when our last medication came out, which is Namenda, and she is 21 now. So we haven't had anything new, unfortunately. But so 21 years is a long time not to have a new medication. But I think what's happening is that, we get our hopes up with a vaccine, with something that's going to prevent the plaques from happening. But unfortunately, we're using it in patients that already have dementia. So I think a good study would be in somebody like me who has, genetic component, and I'm in my early 50s. Give me something that's going to prevent it, and then follow me through for the next 10, 20 years, which is probably never going to happen because it's so expensive, right? Because if they have to follow me for the next 10, 15 years, it's a very expensive study. But that's what's happening, is that we're using the medications in people that already have dementia. So I think, and with FDA approval, you have to show that there's 50% change in the symptoms. And because they're already demented and they don't see 50% improvement, the medications don't get approved. And then also some of them have had really bad side effects, you know, with the vaccine. So it's just one of those things that we hopefully one of these days we'll have more information. But yeah, it's been very slow. And if you look online, there's actually like 100+ studies looking at dementia, because they know that we're past that tsunami. You know, they used to call it silver tsunami. We're past that right now. You know, 1 in 8 older adults has dementia. By year 2050, I think we're expecting that the numbers are going to double or triple. So, I mean, being in any sorts of elderly geriatric business is the place to be right now, because we're all getting older. We're keeping people alive longer. Age is #1 risk for dementia. So #1 risk before even genetics is age. So if we all live long enough, after age 85, 50% of us will have dementia. And we're keeping people alive longer, so we're going to see more and more.
Yeah, and you know, almost everybody has personal experiences with this in every family. You know, my
Yes.
mother-in-law has been in memory care now for, I think, 9 or 10 years. She's 93 years old. She's healthy, but she has severe dementia.
Well, that's the problem, right? The rest of their body's healthy. Like with my dad is the same way.
Yeah. Yeah, she's
But
very
I mean,
healthy.
now he has diabetes because he always wants to eat, because he forgets he ate. And it was getting to a point that he was fighting because he was hungry. And I was like, who the hell cares? Give him whatever he wants. But now he has diabetes, you know? And I was like, whatever. Maybe he'll die of diabetes. But it was not worth it, you know? Poor guy.
Yeah.
That's the only pleasure he has in life right now. That's the only pleasure he has. He doesn't recognize anybody. He's forgotten how to speak English. And, you know, it's kind of like, who cares? Give him a chocolate cake. If he wants, give him an extra piece, actually. That's what he wants.
Well, Doctor, your presentation today was absolutely fantastic. We've run out of time. I wish we had much more time, because this is such an important such an important issue for everybody in our community and in our society. We all fear this more than any other disease, and I've heard that over and over and over again. And I struggle just you know, I've seen a few of your presentations, and I struggle just listening to the presentations. I'm thinking, wow, you know, those are things that we're going to be facing within our own family, and we already are in some cases. So I thank you so much for your incredible presentation. I thank everyone today that took the time to join in. And there is these sessions are going to be available through our website as well. So you can, if you missed something or you want further information, you can go ahead, and contact information is out there as well. So again, I thank you so much. I wish you well.
Yeah, of course.
And thank you, everyone. Have a good afternoon.
Thank you. Bye.